I did my predecessor presentation on epinephrine. It's a drug class of adrenergic agonists. So the uses for epinephrine are anaphylaxis, nasal congestion, asthma, bronchospasms, angioedema, and cardiac resuscitation. That's all over here. The action of it is CNS stimulation, cardiac stimulation, bronchodilation, and then reverses the anaphylaxis reactions. That's the one of the uses. And so the routes for this are subcutaneous, intravenous, inhalation, intramuscular, topical, and intracardial. And really the only one I knew before doing all of this and being in pharmacology was the intramuscular with the EpiPen. But actually the inhalation can be used for the asthma and the bronchospasms, and topical can be used for nasal congestion. And then the intracardial, I talked to my brother about this, and it can actually be used to go straight into the heart. So that's another, I guess, intramuscular, but I just thought it was interesting because it was the intracardial. They use that to, if the heart stops for some reason, they can actually just massage the heart and then put the epinephrine straight into the heart. And then you got the side effects here, and the side effects, they make sense because it's going to be the central nervous system stimulation. So the nervousness, restlessness, tremors, angina, arrhythmias, hypertension, tachycardia, and you're going to get maybe the headache from the hypertension, from all that high blood pressure. You're going to get anxiety because of all of those things just stimulating and working up. And then the drug interactions for this are beta blockers and digoxin. And then over here I have interventions. So for cardiac resuscitation, you're going to give it IV. You can give it IV, and you administer that 1 milligram over a minute, and you flush it out over a minute with 20 milliliters of saline. And then you're going to monitor that IV site for scar necrosis because of the tissue damage it can cause if it gets outside of the vein. And then the antidote for that is to administer the phentolamine mesylate, and that again will be administered over a minute with 20 milliliters of saline flushed after it. And then after it's given, you're going to want to record the patient's vitals and blood pressure every 3 to 5 minutes because of all of those side effects of the heart rate speeding up and everything. You're going to watch for urinary output and watch for bladder distension. And then if you're going to give it to them in an EpiPen, you're going to teach the patient how to use the EpiPen. And so then that comes down to the patient education. So you're going to encourage the use of the epinephrine as prescribed because you don't want to use it more or less than you need to. You're going to have the pen, you're going to tell the client to have the pen always ready and with them, because if it's not with you and you're having an allergic reaction, there's no reason to have it in the first place. And then you're going to always have the medication stored in a cool and dark area, unless it's with you and you can't help it. And then when you use it, you're going to want to call 911 first, or have someone around you call 911 before you use it, and then you want to use it. You want to teach them to do that so that say your allergic reaction lasts longer than the medication does, then you have the paramedics coming there, and if you go back into the allergic shock, you can have more medication on spot, right on hand. And then there's like this little saying that they do. They say blue to the sky, orange to the thigh, and that's how you can teach your patient to use it correctly, because if it goes in your hand when you're shooting it down, or it comes out with nothing, then it's pointless to use. So that is epinephrine.